Hello everyone, welcome back to my channel. Today I'll be discussing the topic of vertigo. Why this topic needs discussion because vertigo can be attributed to a central cause, to a neurological cause, to ENT cause, and also it can be a presentation in cardiac illnesses and also in anxiety disorders. So first here we will be discussing briefly about the balance organ in the ear, how it maintains the balance, why this peripheral ear organ is required, and how we can differentiate it from neurological causes and cardiac issues. So this balance organ in the ear has three semicircular canals and two otolith organs. So these semicircular canals detect the rotatory movement of the head, and this otolith organs detect the linear accelerations like horizontal or the vertical accelerations of the head. So the main function of this peripheral balance organ in the ear is to maintain the gaze when there is movement of the head. Along with ear, what other parts of the body are also important for maintaining the body balance? This include the vision, our body joints, the mainly the ankle joints, the lower limb joints, the muscles of the abdomen, muscles of our legs, and also our this neck, the cervical part. If there is any pain or strain, this can also cause a lightheadedness or unsteadiness in. So coming to the presentation of vertigo due to ear. So the vertigo due to issue in the balance organ in the ear presents with a spinning or rotatory sensation either of the head or of the surrounding of the patient, and associated there can be nausea, vomiting, diarrhea, excess sweating. The other features which can be associated with vertigo due to ear are ear fullness, ear block sensation, tinnitus, then autophony, like you feel that whatever you're talking you hear it loud, or there can be perceived you feel you are not able to hear at all from that ear, or there's reduced hearing from that ear. And this vertigo can be acute single episode, or it can be episodic or recurrent type, and can also be chronic vertigo. So the acute is can be with or without hearing loss. If it is with hearing loss, means there can be an infection or inflammation of the main balance organ, that is labyrinthitis. And if it is without hearing loss, it can be due to acute neuronitis or just the nerve damage, that is inflammation of the nerve of the balance. Then mumps and herpes infections can also affect, along with hearing, it can also affect the balance. Then there is entity called as episodic vertigo or recurrent vertigo. If there is recurrent episodes of vertigo with change in head position, and with some food intake, or due to stress, or due to increased pressure, like when you're voiding or coughing or vomiting or doing Valsalva maneuver, then that also points towards a that can also be due to a peripheral cause. So the vertigo due to ear balance organ can last from few minutes to days. It can last for days. And then how can you differentiate between vertigo due to ear or due to neurological cause? So if the patient has associated severe headache, or any weakness or numbness in the limbs, or if there's a cranial nerve deficit, like if it's a facial palsy, or the patient has slurring of speech, the patient is not able to swallow feeds, or the patient is disoriented, that means it is not related to ear. Then patients who present with complaints ki they have this true vertiginous feeling or spinning sensation when they have stood up from a sitting position, sudden way when they stand up from a sitting position, or when they have been standing for a prolonged time, that is mostly entity called as orthostatic hypotension, that is not related to ear. That vertigo is not related to ear. Then some patients have this increased perception of their heartbeat, that palpitations, and also there can be dizziness, they feel lightheadedness, they feel giddy, and then there can be vision blackouts, and there can be loss of consciousness. So these point more towards a cardiac cause than a ENT cause. Then the patients who have anxiety, they present with, along with this rotatory phase spinning sensation of the head, they also present with breathlessness, they also have palpitations, increased perception of their own heartbeat, and they have lightheaded feeling, and they have this extreme social phobias, and they try to avoid those situations. So these point more towards an anxiety disorder, and not vertigo because of ear. The other diseases which can mimic a spinning sensation or rotatory feeling, the patient might complain that the patient has vertigo, is when they have thyroid disease, anemia, diabetes. When should you get a radiology or imaging done? When along with this spinning sensation, as I described, rotator feeling with nausea, vomiting and all, and you have associated acute complete deafness of 1 year, you have associated weakness of your limbs, back of your head you have severe headache. So I've discussed very briefly, differentiated how you can identify whether you have a vertigo or spinning sensation because of the ear organ, or because of a central cause, or because of a cardiac cause. If you have any doubts or you need more clarifications, you can put up your concerns in the comment section below, and please like and subscribe to this channel. Thank you.